Good day. So we're going to discuss now about animal diseases. So just a heads up, yung reference book natin is hindi na natin gagamitin. So we're going to change that one. So I have a new reference book. So yun na lang yung gagamitin natin. And I will be providing videos na lang para hindi na kayo masyadong maraming binabasa. I will do the summary and I'll try to explain it to you. Hopefully makaya natin sa remaining time. So, let's discuss now yung first chapter na binigay ko sa inyo. So, since pinasa nyo naman yun, we're just going to discuss that one. So, types of diagnosis. So, we have here, meron tayong apat. So, first is the clinical. Meron tayong clinical pathologic, morphological, and etiological. Now, in other books, actually, yung clinical pathologic is just under the clinical. So sa reference nyo, they created a different category. So when you say clinical, it will be based on history, clinical science, and physical exam. So during physical exam or physical examination, it now depends on you kung ano yung judgment mo sa appearance ng animal. If tingin mo if ang animal ba is weak, dull yung mata, hindi alert, so depende na yun sa'yo. Now, in farm setup, usually yung history is provided yan by the staff. Kung sino talaga yung nagabantay, sila kasi yung may maraming time na kasama yung animal. So, clinical signs like fever. So, by the way, difference ng clinical signs at saka ng symptoms is in clinical signs, it is something we can measure. So, for example, like in fever, we can measure that one by using thermometer. Yung isa naman, yung symptom, like headache, example yung headache. So, sa animal setting, we usually don't use the term symptoms kasi hindi naman din nakakapagsalita yung animal na saying, masakit yung ulo ko. Usually, we solely depend on the clinical signs. So, like fever. Clinical pathologic, so it's based on, usually in hematology, ang tinitingnan is the level of, or gaano ba karaming red blood cells, gaano ba karaming white blood cells, gaano ba karaming platelets. So, yan yung sa hematology. And yung sa blood chemistry, like sugars, creatinine, at iba pang mga hormones. Now, so morphological, macroscopic, and microscopic. But usually sa clinical setup or sa farm setup, usually hindi na ito na nagagawa because you need to process the tissue for you to have a microscopic samples for microscopy. And just to give you an idea, yung sample nila is galing yun doon sa organ na highly affected. So for example, in the case of respiratory problem, they collect tissue sample doon sa affected lungs. When it is etiological diagnosis, so dapat andyan yung causative agent. So meron talaga name. So for example, merong Clostridium tetani infection. So kapag merong name ng virus, ng bacteria or ng fungi, that's etiological. So let's discuss now inflammation. So according to Stedman's Medical Dictionary, ito yung definition ng inflammation. So masyadong mahaba, kaya na bahala basa. Anyways, I underline the important phrases. So first, it is a pathologic process. So that means involved siya sa sakit. And meron din cytologic changes. That means there are changes at cellular level. Merong cellular infiltration. That means involved yung mga white blood cells. Meron ding mediator release. That means merong mga chemicals na nire-release during inflammation. Kaya nagkakaroon tayo ng fever, that's because of the chemicals that are released during inflammation. So affected in ang blood vessels and adjacent tissues, and it is a response to an injury or abnormal stimulation. So for example, na-sting ka ng bee, that's an example of abnormal stimulation. And at the end, there is healing and repair. Healing and repair is a very important part of inflammation kasi, for example, nasugat ka and hindi magkakaroon ng healing and repair dun sa area, that area will be constantly infected by microorganisms. So, hindi magkaroon ng stoppage doon sa problema. So, patuloy pa rin yung problema doon sa area. So, meron tayong tinatawag na cardinal signs of inflammation. That means, makonsider lang siya na inflammation kapag present itong lima. So, first is rubor or the redness, and it is caused by hyperemia. Hyperemia is the increase in blood flow sa certain area. So, by the way, yung rubor, that's Latin, same with calor, dolor, tumor, and punctulasa. So, those are Latin terms. So, kapag merong heat, or in Latin, that's calor or warmth, no? That's also due to hyperemia or increase in blood flow. So, dolor, that's pain. So, masakit ang inflamed area because masyadong sensitive yung nerve, and also there are chemical mediators that are being released to stimulate the nerve. Meron ding swelling or tumor, that's because of exudation. Exudation is yung fluid normally na nasa blood vessel is lumalabas and napupunta doon sa area kung asan area na merong problema. So, for example, na-sting ka ng bee, lumalaki siya because pumupunta din doon yung fluids na normally andun lang sa blood vessels. So, loss of function, ang last actually, yung punctulasa is late na yan na-add. Dati daw, yung 4 lang muna, yung rubor, calor, dolor, and tumor. So, ito yung 5 cardinal signs of inflammation. So, we have here an illustration, a simple illustration for you to be reminded of the cardinal signs. So, merong heat, redness, swelling, so, mag-swelling tiyan. So, yung isa, in pain, kaya isang paa lang, and one is the loss of function. Now, inflammation is actually a natural defense of the body. However, there are times na nagiging sobra lang, masyadong reactive lang yung katawan, and hindi na siya nagiging beneficial. So, we have here beneficial and harmful aspects of inflammation. So, this is based on reference. So, one is diluting and or inactivating toxins. So for example, na-sting ka ng bee, so merong toxin nandun. So, kapag nagkaroon ng exudates doon, so nagkakaroon ng fluid, nadidilute ngayon yung toxin na galing sa bee. So, second is killing microbes and foreign materials. So, for example, merong bacteria na pumasok sa katawan. So, due to inflammation, pupunta doon yung mga white blood cells and papatayin nila yung mga microbes na nandun. So, that's the reason why sometimes you see pus. Pus is just an accumulation of white blood cells, a dead white blood cells. And also, beneficial aspect of inflammation is providing healing, because eventually dapat mag-end talaga yung inflammation. Dapat mag-heal. If may sugat, dapat mag-close ng sugat para wala ng entry point. And also, it will restrict the movement. Kapag nagkakaroon ng inflammation sa certain areas, for example, sa siko, na-sting ka ng bee sa siko, so the nerves around that area will be very sensitive to pain. So, in a way, hindi mo siya parang masyado magalaw. And in terms of healing, less movement means faster healing process. So, kapag merong inflammation, pwede magkakaroon ng localized increase in temperature or as a whole talaga sa buong katawan. Now, kapag localized lang, but nasting ka ng bee, so, usually localized lang. But kapag masyado kang hypersensitive to the bee sting, pwede magkaroon ng generalized na reaction. So, kapag mayroong fever, so that's a total body increase in temperature. Kapag ganyan, that means merong infection. So, merong acute and chronic inflammation. So, when we say acute, masyado lang yung mabilis ang onset. So, minutes to hours lang ang onset. Ang chronic naman is slow. So, in terms of duration, yung acute inflammation, hours to days lang yan, and chronic is weeks to years. Now, yung fibrosis naman, or yung scarring, usually mild, and minsan, hindi mo siya makita talaga kasi masyado lang maliit. Now, yung sa chronic is often severe. Like, for example, yung sa liver ng isang taong mahilig uminom at nagkakaroon ng liver cirrhosis. So, years and years of fibrotic tissue na yung nandun So, parang tinatry lang repair ng liver yung sarili niya. So, nagkakaroon ng mga fibers doon. So, actually, the scarring or the fibrosis doon is, it's a defense mechanism of the liver para contain yung damage. However, eventually, hindi na makontrol. So, minsan may iba na namamatay due to hepatitis. Local and systemic signs, usually prominent yung sa acute kasi mabilisan. So, you see it right away. So, mafeel mo kaagad. Usually, yung chronic inflammation is parang hindi napapansin ng individual. So, parang na problema inside but hindi masyadong prominent. So, parang akala niya normal lang. So, nabasa nyo rin dun sa reference nyo ang causes of cell injury. So, one is hypoxia or lack of oxygen. Second is physical agents like high temperature, pwede yung mag-damage ng cells. So, infectious agents like bacteria, amoeba. So, like in the case of amoeba, yung lining ng intestine is nasisira. So, nagkakaroon ng internal bleeding, doon sa intestine. But, ang individual or ang animal is infected with amoeba. So, nutrient imbalance also, nagkakaroon din ng cell injury because the nutrients needed by the cell is hindi na provide. So, mutation, that's also one. For example, yung sa pox virus infection, yung sa kalunggo. So, nagkakaroon ng mutation ng cells, nag-iiba na yung shape, so kaya tumitigas, lumalaki. So, that's one cause. So, workload imbalance as well. So, for example, you lift too much weight. So, kapag masyadong nasi-strain, so, pwede magkaroon ng workload imbalance as well. So, kapag masyadong nabigatan sa trabaho yung muscle, pwede ma-tear. Pwede magkaroon ng problem. Also, chemical drugs and toxins. So, merong mga chemicals na very destructive to our cells. For example, like hydrochloric acid or sulfuric acid. And also, there are drugs that we use in animal production that can cause injury to the cell. So, for example, like oxytetracycline. I experienced before I injected it intramuscularly tapos yung animal is parang naging pain because of the drug. Immunologic dysfunction. So, mga autoimmune diseases. So, merong ibang mga diseases na ang nagkukos is yung sariling katawan ng dead. Hindi niya na alam kung sino yung dapat napatay niya. And aging is the last one. So we have here an illustration about cell injury and necrosis. So for example, we have here a normal cell, and once that cell is exposed to a certain stress, pwede siya mag-adapt. However, if the stress is very strong and injurious na, so pwede magkakaroon ng cell injury na yun. So, if ma-stop yung injurious stimulus, pwede na siya babalik dito. Magiging normal siya ulit. However, if that is a very severe stimulus, pwede magkakaroon ng irreversible injury ngayon. Kakaroon ng necrosis or death of the tissue or the cell, and pwede rin magkaroon ng apoptosis or magsisuicide lang yung cell. Apoptosis is also known as reprogrammed cell death.